Welcome back to Mice TV, live from the Cake and Pie Expo 2.0 in Da Nang, Vietnam. And thanks, Brooke. Don't think we can all wait for that symposium, excuse me. In the meantime, though, we have a special treat, a cake talk on Botox and fillers in ophthalmology. I'd like to welcome Dr. Isha to the show. Welcome to the show, Dr. Isha.
Thank you, Matt. It's been an honor to be here.
Oh, thank you. So how are you doing?
I'm doing great. It's like my second time to Vietnam and first time to Da Nang.
First time to Da Nang.
Yes, and it was amazing. The Orbis party last night, we had a lot of fun and it was amazing.
So let's get into our topic today. Now, I was looking at your LinkedIn profile and you wear a lot of hats. You have a lot of specialties. Why don't you tell us about all the things that you do?
Well, so I am basically an ophthalmologist, but I practice as an advanced cataract surgeon, an oculoplastic surgeon, and a facial and ocular cosmetic surgeon. So what I basically do is I do all kinds of cataracts, simple, complex, complicated, and referral of cataracts. I do oculoplastics. In oculoplastics, we do mainly like lid, lacrimal, and orbit. So in lid, we do like different kind of cases like ptosis, entropion, ectropion, reconstruction, trauma, and everything, tumor removal and then reconstruction. In lacrimal, we mainly have like, duct blockage and at which level, and then we decide the management. And in orbit, we have like different kind of tumors, trauma reconstruction, and these are the things I basically do in oculoplastics. Well, in cosmetic, the things are advancing, So as an ophthalmic surgeon, we have limited scope, but things are increasing, like blepharoplasties, eye lifts, kind of mid-face lift, and we do like non-surgical treatments like Botox and fillers and different kind of lasers. So these are what the patients want these days. If you're a plastic surgeon, they don't only come to you for surgery, but also for the non-surgical treatment. So it has got a very wide scope of services these days.
Medical school must have been quite busy for you with all those specialties.
Yeah, medical school was super busy, and following that, the super specialties were even busier.
So let's talk a little bit about those subspecialties. Oculoplasty. I mean, what made you decide to take this up?
Well, as a confused resident, like every resident is confused, So after I finished my residency, 3 years in India, I was very confused. Like, should I take up refractive surgery? Should I take up cornea? Like, what should I do? And then I was like, I started doing cataracts, and slowly I shifted to complex cataracts after residency, and I had a fellowship. And then I was like, let me get into, oculoplastics, because I slowly started doing these surgeries on my own. And then I was like, I kind of like this branch. And then I got into the fellowship program. I was at UCLA for 3 months, and I got into UCLA, and after that I did another fellowship in, in our country. And now I have a training lined up at SNEC.
Oh, great.
Yeah, Singapore.
When are you going there?
I'm going there in October.
Oh,
okay.
So
yeah, it's a short one, just for 20 days. But I think these are important to keep brushing up your skills, right?
Right.
Like,
continuing your education and your practice, and definitely it never ends, really.
It never ends, and it's fun that way.
So let's talk about Botox. Now, this is botulinum toxin, excuse me, and I think most of our audience is going to be familiar with that through the anti-aging, anti-wrinkle. So, why do you use this? What is the mechanism of action of this bacteria in ophthalmology?
Yeah. So what happens is botulinum toxin, what we already know, it's produced by a bacteria called Clostridium, right? And what happens is in our body, like it has got a neuromuscular junction where acetylcholine is released, and then the muscle contracts, like any muscle, be it facial muscle, be it the muscle of the hands. So what botulinum toxin does is when we inject botulinum toxin, it gets into the neuromuscular junction and it prevents the release of acetylcholine. So when it prevents the release of acetylcholine, the receptors are empty. There is no acetylcholine binding to the receptor, and hence the muscle don't contract. So now take it on the wrinkles. When your muscles are not contracting, the wrinkles are not happening.
So what kind of conditions are you using this for? Kind of treatments?
The Botox?
Yeah, Botox.
Yeah. So Botox, we use it mainly for functional and cosmetic purposes. For functional, you use it for blepharospasm, hemifacial spasm, migraine. These are the things you use in functional condition. In cosmetic condition, there are like various conditions. So first you have to see if the wrinkles are static or dynamic. If the wrinkles are static, that means even while you're not talking, when you're in the rested state, you have got wrinkles. So Botox can do nothing much in that state. What it can only do is in the dynamic state, like when we are talking and the wrinkles are appearing, right?
So if you lift your forehead.
Exactly, yes.
And then they come.
Yeah.
You can tell I haven't had Botox because there are lines when I raise my eyebrows.
Exactly.
My eyebrows still move.
Yeah. So yeah, we do it for the frontalis, which is the forehead Botox, the crow's feet, which is the orbicularis, under eye, then nose, the lips for smoker's line, and these are the various places where we use Botox very commonly.
Yeah, now quick question. As Brooke and I were preparing for this segment, I mean, she mentioned she hasn't had Botox. I mean, you're injecting a poison into you. Does that, I mean, like, how do patients feel about that? Do you have people that just say, oh, I don't want that, or is there a lot of resistance?
No, I think people are very well read these days, you know. So how the Botox is processed and produced, it is very regulated. Yeah. So that way our patients are safe. In fact, all the medicines that are being produced and marketed are safe because everything is derived from something or the other. Like not all the, medicines have a natural derivative. So everything is processed and regulated very well. So I think it's pretty safe. Yeah.
Let's change over to fillers because that's the other half of our talk today. So fillers are things, more anti-aging stuff, volumizing things like lips, cheeks, in cosmetic surgeries. What kind of ophthalmic or clinical uses do we have for some of these fillers?
For fillers, we mainly in ophthalmology, the most commonly done indication is under eye filler, which is for tear trough deformity. So tear trough, it can be of various kinds, but mainly it's for hollowness. You see these under eye hollowness the patients have, and also sometimes the patients come with initial stage of eye bags. So eye bags, the big ones, the huge ones people have, that cannot be cured by fillers. That will need a lower bleph. So the initial stage of the eye bags, we can camouflage with fillers. So patients can be satisfied for a year or two, but ultimately the patient will need a surgery.
Yeah, so another thing that it is really interesting.
Stuff that you don't really even think about because we don't touch on this quite as often. So it's so great to have you on the show and the specialty.
Yeah. Now, I do have another question. When I was researching this, there are so many different things that so many different types of fillers, so many materials.
Of course.
What do you have a recommendation for all those who are thinking about incorporating this, or what's the best?
So I'll tell you something about fillers. Fillers have got different derivatives, like all medicines have derivatives. So we basically classified into 4 categories, which is heterogeneous, allogenous, auto, and synthetic. So in hetero, we have another 3 categories, So one is from bovine collagen. So which most of the bigger companies like, Galderma, Restylane, all of these companies, they are using those materials, right? Another is from human collagen. So human collagen is kind of safer, but we also have a better material these days, which is the hyaluronic acid. So the hyaluronic acid, it is a heterogeneous material, but much, much, much safer for all kinds of its indication, right? Another one we have is allogenous, which is, like I said, it's from human collagen. Another is autogenous. So what we do these days, we are using a lot of nano fat graft. What is it? It is from the fat of the person itself. That is a complex surgery, but safer. Safer because it's its own material. It's, it gives a very rejuvenated appearance because it's their own stuff. And you can even, you can get a good quantity. And the others are synthetic fillers, which we don't generally use, like, silicone and stuff.
It's just so interesting. I mean, most people think, cosmetic surgery, but you're really just doing good for people who need it and, to feel better about themselves and, for a clinical standpoint. I think that's really cool.
For sure. Yeah.
So is there anything else you'd like to add or say to our viewers out there?
Any doubts you have before starting Botox and fillers, just ping me. I'll be available to answer all your questions over email, over WhatsApp, I don't know. And I'll be happy to help anyone, whoever wants to get into this subspecialty. And
yeah, great. Yeah. Wow. That was, I mean, this was definitely one of the segments I was looking forward to most. That was really interesting, Brooke, wouldn't you say?
It definitely was. You actually might have convinced me. I didn't know you could get Botox underneath the eyes.
Yes, we can.
So thank you so much for coming on the show, Dr. Isha.
Thank you so much.